Hi, everyone. My name is John Bowman. I am the Kentucky Senior Campaign Organizer at DreamDotOrg. I am a person in long-term recovery. I'm a person that is justice impacted, and I'm a person who has used this harm reduction services. So they are very needed across the country. So thank you, Jay. First and foremost, pop quiz time. So how much more powerful is fentanyl than other opiates like morphine?
This is what the answer is.
Okay, so fentanyl is approximately 50 to 100 times more potent than morphine. All right, the drive towards harsh criminalization due to fentanyl and the rise of fentanyl. So potency and danger wise, again, fentanyl is, approximately 50 to 100 times more powerful than morphine, which leads to high overdose rates. When I was in the midst of my drug use back in the day, fentanyl was few and far between. You didn't hear a lot about it. And now it's in everything, so people have to be really careful when they use drugs, and that is one reason, like with some of the harm reduction measures that Jay was talking about, is fentanyl test strips. We passed a bill here in Kentucky last year that legalized fentanyl test strips. For that, they were actually paraphernalia. You could charge a paraphernalia for having them, which is absurd, but it happens. And then distribution and accessibility. Fentanyl is, produced overseas, is produced cheaply. It's also produced in Mexico. You can get the ingredients pretty cheap, and people are putting it in everything these days. So it's mixed with almost every drug out there, and you can get it online. I've known people that bought it online. It's one of those things we have to be very cautious about, and we need to talk to our youth about this. This is a very dangerous drug. It has very serious risk associated with it. It's a very high overdose risk, and that's one thing that we need to bring up in those conversations. All right, current trends of criminalization. For my Kentucky folks, you know this well. We just had one of these DIH, drug-induced homicide laws, on our nice Safer Kentucky Act this year. As we all know, incarceration, it does nothing for addiction. It does nothing for substance use disorder. Only thing it does is add more trauma to folks. So we have to find a way to get these. I see that Congo boo HB5. That's correct. We have to find a way to get these laws rolled back and changed, because we're not doing anything to help folks. And again, it's mostly out of fear that we're getting these laws. We're getting folks that really have not been educated to the fact of different measures of harm reduction, recovery, whatever that may be. But they see that this is a potent drug and it's killing people, so their first thought is, hey, let's lock them up, because that's worked so well for the past 50 years. If incarceration worked, we wouldn't have this overdose crisis in America at this point, because we incarcerate more people than anywhere in the world. So, by this point in the 50-year war on drugs, we should be out of this, but apparently we're not. So as you can see, there's been, these kind of laws passed around the country. California new law for 2024, longer prison sentences for fentanyl trafficking. Again, that's not doing anything to really curb the issue. All it is overcrowding our prison and jail system more than it already is. So we have to find ways around this. We have to find things that work. We have to do evidence based in this, and fear based is not going to cut it. Legislative responses: enhanced penalties for possession, distribution, and trafficking of fentanyl. Again, things that do not work. Federal initiatives: Department of Justice operation on synthetic opioid surge, and DEA's class-wide rescheduling of fentanyl and analogs. Fentanyl does have a place in the medical field. As Amanda alluded to earlier, it is used in surgeries. It is used for people's recovery in the medical field. So if we reclassify that, they can't really use it for those things. So these are all based off. It's a fear response here in the United States. And then we have like state level actions, like again, House Bill 5 here in Kentucky, Florida's House Bill 477. And New York has increased penalties for fentanyl offenses as well. And then you have international cooperation agreements between America and China to really curb fentanyl exports into the country. And hopefully, we can do that, but people are not going to, we have folks that bring these drugs in. They're not going to give that business up. That's a multi-billion-dollar a year business. So we have to figure out a way to make sure we're keeping folks safe. And again, incarceration is not helping. One of our biggest rates of overdose in America is when folks leave incarceration. So, that's definitely not helping our substance use there. All we're doing is adding more trauma and overcrowding our prison system with these things. Drivers of harsh criminalization, public fear, political pressure, overdose epidemic, the media coverage on it. We've had a opioid epidemic in this country for a long time, but it really didn't get brought to light until it hit the suburbs. Again, that was one of the things that was brought up earlier. And when heroin was big, through the Vietnam War, it wasn't problem to the rest of America because it stayed in the Black and brown community, so we didn't see it as a problem. So now that it's in the suburbs and you have teenagers of well-to-do parents dying of drug overdoses, now it's a huge problem. And again, they see their friends' kid die, or one of their kids get overdosed from fentanyl, and it's a fear response again. And then we have law enforcement and policy advocates, strong backing from law enforcement agencies for tougher laws. Luckily here in Kentucky, we do have some law enforcement officers that are willing to work with us on some of these things, and they know that incarceration isn't working when it comes to these issues. So they're trying to find alternatives to that. And, that is something that's needed in this country. Again, incarceration is not going to fix substance use. So we have to find alternatives to that. We shouldn't send someone to prison for, years and years because they are an addict. What good is that doing them? It's not. We're not helping them in the least little bit. And then we have our historical precedents, the 94 crime bill. So that was like one of the reasons that our jails and prisons are overflowing with folks with drug charges. We have a continued reliance on punitive measures here in America, and we need to find those evidence-based measures that really help us move forward and really curb this issue. So implications of more criminalization. Our national drug overdose deaths from 99 to 2000 to 2022. And this is not on here, but I'm going to bring this up. We had more folks die from drug overdoses in that span of time from 1999 to 2022 than we did in World War I, World War II, Korean War, and Vietnam combined. So let that sink in. And that's also, it's the same amount of time. It's a 23-year span. We have well over a million folks die in that span. And we had 610,698 folks die in those four wars combined. And we have well over a million in the same 23-year span. That says a lot. It shows that what we're doing isn't working. So we have to try something else. We have our public health concerns, increased overdose risk and barriers to treatment. Here in Kentucky, it gets said a lot that we have more treatment beds per capita than anywhere in the state, but we have barriers to that with access to those beds. And we need those beds across the country, not just here in this little piece of heaven that's the Commonwealth of Kentucky, but we need them across the country. And then you have your justice system impact on folks. Folks are going to prison and jail for being addicted to a substance, for having substance use issues. They're getting longer prison sentences than going out and hurting someone. That doesn't make sense. So we have to get out of the mass incarceration piece and really, again, evidence-based. I'm going to say it a lot because it's true. Then we have our social and economic costs. It's a disproportionate effect on marginalized communities, mostly communities of color. That's where a lot of these laws have really been based. And you see that in our prison system. We have, it's the number is nuts. So it's just one of those things that we have to work on. We have to be willing to stand up for and willing to take this fight. Okay, criticisms and alternatives to harsh criminalization. So advocating for balanced approaches, combining law enforcement with harm reduction and public health initiatives. Like the Measure 110 in Oregon that got rolled back, unfortunately. But it was a good start. It was a good place to start. And for me personally, I choose to work with law enforcement here in Kentucky that are willing to work with me, who realize that incarceration isn't working and who are willing to get folks the help that they need, willing to work with harm reductionists. And we have some amazing folks here in Kentucky that do harm reduction. And I know there's amazing folks in other states as well that's doing amazing work. But we have to get out of those silos, and we have to be willing to work with the people that are doing the work and really come together, because we can do a lot more together than we ever can apart. And this is too big of an issue for one person, one organization, one entity to tackle alone. So we need collaboration across the board on this. You have your criticisms, it's ineffectiveness in reducing drug use or trafficking and human rights concerns, but you also have to look at the fact that we have criticisms on anything at first. And the way that it was told to me is like, if you don't have haters, you're not doing something right. So we're going to have people that say, you're just enabling drug use, you're doing this, that, or the other. But the fact of the matter is, I was a drug addict for a long time, and I didn't need anyone to enable me to do it. I was going to do it regardless. I didn't care about the consequences of my actions. All I cared about was getting high. I cared about my next use. And, those things didn't matter to me. It was the getting caught part that really made me start changing my ways. I got tired of being incarcerated. We're going to have the criticisms on these things, but we have to stand up for it. We have to be able to be a voice for those folks that don't have one. We have to be willing to make those statements and really push back against folks that are trying these punitive measures again and again and again. We have to be willing to tell them, hey, like this hasn't worked for the past 50 years. So why is it going to work now?